Mr. Speaker and honorable members, as I reflect back on the past 26 months, it actually pains me to recall the huge devastations caused to and sacrifices made by so many people in our community as we fought together against a pandemic never before seen in our generation, as when the one that was announced by the World Health Organization declared COVID-19 to be a global pandemic. On the 18th of March 2020, Bermuda recorded its first positive case of COVID-19, and on the 1st of April 2020, pursuant to Section 14.3 of the Bermuda Constitution Order, the governor declared that a state of emergency exists in Bermuda. This was the precursor to the Public Health COVID-19 Emergency Order 2020, as the government deemed it necessary in the interest of public health to take extraordinary measures to prevent, control, or suppress COVID-19. And as such, it was declared that a public health emergency existed in Bermuda. Mr. Speaker, in the intervening period, a number of quarantine and travel ban orders were made. In addition, critical public health restrictions were put in place. Curfews were imposed. Gathering sizes were restricted. Households were prevented from mixing. Working from home was required. Schools were closed. Most businesses were closed. Gyms, restaurants, museums, movie theaters, all were closed, and the doors of places of worship were shut. Mr. Speaker, this impacted the entire community, as weddings were canceled, birthday parties were postponed, funerals were severely limited, and visitations to loved ones in rest homes, hospitals, and corrections facilities were halted. Together, we witnessed wave after wave after wave of SARS-CoV-2 virus outbreaks, and sadly, all too many people lost their lives due to COVID-19. Much has changed over the course of the past 26 months. The introduction of vaccines has greatly improved our chances with respect to how we mitigate against the devastation caused by COVID-19. In November last year, I indicated to this honorable House that the next step for all of us in Bermuda is to learn how to live with COVID-19, as we have arrived now at that step. As COVID-19, Mr. Speaker, continues to run its course, scientists generally believe that SARS-CoV-2 virus will become endemic for many regions in the world, circulating amongst the populations, but causing fewer and fewer cases of severe disease or death. This will be due to immunity achieved largely through vaccinations and also to a lesser extent through recovery. However, this will not happen overnight. There are a number of African nations, for example, Mr. Speaker, where the vaccination rate is not yet 15% of their total population. As of the end of Epi Week number 4, which ended on January 29th, 72% of Bermuda's total population is fully immunized against COVID-19. And although the Omicron variant is still with us, compared with the Delta variant, we have so far experienced significantly fewer hospitalizations and deaths. What does all that mean? It means that the pandemic is not over for the world, but Bermuda is in a position as a country to move out of the substantive public health emergency restrictions. In keeping with the stage Bermuda has reached, the government is making the following changes to the Public Health COVID-19 Emergency Powers Phase Reopening Regulations 2021. The size of large groups will increase from 20 to 100, and this includes weddings and funerals as well as island boats. In restaurants, members clubs, bars, gyms, and island boats, safe key will no longer be mandatory, which means a 7-day student pass is no longer required for these venues. Tables will continue to be limited to groups of 10 and be spaced 6 feet apart, and these dining establishments, bars, and clubs will still be restricted to seated service only. More importantly, Mr. Speaker, however, the requirement to wear a mask while indoors in all venues will continue. As honorable members know, this coronavirus is transmitted through the air as droplets. As such, wearing a mask, particularly indoors, will be vital for the foreseeable future. It is one of the greatest tools we have in our arsenal for the reduction of transmission. The legislative and relevant public health guidance that I just spoke about They will become effective from today, the 4th of February at noon. The government anticipates this transitional stage will continue until the end of March. From April onwards, Mr. Speaker, the public health emergency will be in place only to support the continued requirement to wear a mask indoors. Mr. Speaker, I cannot overemphasize the importance of continuing with public health measures in addition to wearing a mask. Wash your hands and maintain physical distancing of 6 feet from others in crowded indoors and outdoor settings. And yes, get vaccinated. Finally, Mr. Speaker, I would like to take this opportunity to thank the Bermuda community for their adherence to the public health restrictions. While necessary, we know that these measures have taken a great toll economically, socially, and in terms of our mental, if not physical health. And I thank you. Mr. Speaker, I would also like to extend a sincere thank you for the health teams for their incredible dedication and commitment to the people of Bermuda. The chief medical officers, first Dr. Cheryl P. Gall and then Dr. Ayo Olenye, have provided wise counsel and a sturdy hand throughout. And health and other professionals across the spectrum of the health system, be it testing, diagnostic labs, contact tracing, and case management, the hospital, the coroners, funeral homes, all have worked long days and nights and weekends to help to keep us safe. To all of you, I say thank you.